Pacific Prime is a health insurance broker. We've been working in this industry for 15 years and we advise individuals and corporates on health insurance matters. We pretty much work with all the health insurance companies, but one company we've worked with extensively over the past 15 years is Bupa. Bupa is a Provident Association, as it says in the name, British United Provident Association. It basically means it's run for the benefit of its policyholders. It has over 36 million members worldwide and is an extremely focused organisation, only looking at things related to health. Its motto or mantra is living longer, healthier, happier lives. We enjoy working with Bupa because they are so focused on health insurance. They have many operations around the world related to insurance. These may be domestic operations in the UK or Australia or Hong Kong, but it also has an international division which focuses on insuring people around the world in countries where there is no local operation or there's no access to health insurance in those countries. Bupa runs several health insurance plans in this area. One is called the Lifeline, which has been around for many years, and the plan which came out around 2 or 3 years ago was the Worldwide Health Options plan. They're both extremely comprehensive and suitable for many clients. Bupa is a great organisation to work with and perhaps one of the most trusted health insurers that we know, because they're so focused on the industry. If you're looking for advice on Bupa or looking for advice on any type of health insurance, please talk to us.
Many aging Americans are getting quite a shock. They're finding out that the long-term health insurance they bought years ago isn't doing what they thought it was supposed to.
Now, battling those insurance companies to get them to pay can be exhausting, both emotionally and financially. Correspondent Cheryl Atkinson is in Washington with one family's bitter struggle. Good morning, Cheryl.
Good morning. Well, long-term care is still a relatively new form of insurance, and while millions of Americans have the policies, as you said, it's not always working out as they planned. And we investigated one case in Kansas.
Now, how many kids do you have?
5.
93-year-old Timber Harwood has always taken care of his family and planned ahead. For years, he faithfully paid premiums for long-term care insurance with the hope that it would help cover the cost of everything from home care to nursing homes if he ever needed it. Gwen Wedd is Timber's daughter.
He was very conscientious and proactive at getting a health care plan that would help him down the road.
They needed the help in 2010 when Timber suffered a serious fall.
There you go. Whoops.
A home health aide helps him with dressing, meals,
You like the grapes, don't you?
and medicine. But when it came time for the insurance company, Bankers Life, to pay, all the family got was the runaround. They repeatedly faxed hundreds of pages of required documentation.
The company would say they didn't get the faxes, so we sent, 300 or 400 pages in an overnight, and then they lost that. They couldn't find that anywhere, even though someone in the office signed for it.
Their faxes lost, their mail lost, their paperwork missing. That went on day in and day out for almost a year, all while Timber spent down his savings. Finally, the family turned to Timber's niece, Sandy Prager.
It almost sounds like death by 1,000 cuts.
You're trying to do the best for your loved one, and then you're having to fight for something you believe you're entitled to.
Prager is speaking as more than Timber's relative. It so happens she's also Kansas's lead insurance regulator, and she knows Bankers Life all too well.
Hundreds of policyholders had complained the company beat them down with bureaucracy and counted on them to be too sick to fight back. In 2008, Kansas and 39 other states had found a pattern of consumer harm at Bankers Life that included unjustified delays and bad record keeping.
They were able to demonstrate a pattern that appeared to be at least designed to frustrate people.
Bankers Life and a sister company eventually admitted no wrongdoing, but paid $32 million for fines, restitution, and system improvements. Yet complaints continue to grow. As CBS News analysis found in 2010, Bankers Life had shrunk to less than 6% of the market share, but drew 1/3 of the complaints reported by state insurance commissioners. Bankers Life wouldn't talk with us, citing privacy concerns. In a statement, they said they paid $1.3 billion to 1.3 million customers, including long-term care policyholders, and are committed to the highest standards for ethics, fairness, and accountability. Once Prager got involved, Timber's claims from the past year finally got paid, but his struggle wasn't over. Banker's Life recently questioned Timber over the phone and concluded he's too healthy to continue getting home health care, a finding his family disputes but says they're too worn down to fight.
How sad it was for him to feel like he'd failed almost, and that was the worst part.
Timber's family says instead of providing peace of mind, the long-term care that they counted on has only left them worried about his future. Nancy?
And Cheryl, I imagine that this is not the only insurance company that is having this kind of problem.
Well, there are a lot of problems. Certainly many people do get paid and are happy with their insurance, but we spoke to experts for this story who say that for a lot of others, long-term care insurance just isn't paying as advertised. And even some insurance companies now admit they didn't realize how expensive it would be to carry this type of coverage, and they probably underestimated what they needed in premiums to stay afloat. So now customers may be faced with hefty premium increases after they paid on policies for years at a time when they can't afford it. And that's just one of the issues.
Wow, one of the shocks people really don't want to have. Cheryl Atkinson in Washington, thanks so much.